Good afternoon, everybody. Thank you very much for that kind interaction. So, my given topic today is communication during emergencies. So, I think it's a very good time to talk about communication after lunch, being the last part of the day. Everybody is want to go home early. So, I thought I might discuss very important few topics with using very few time. And the second thing, I'll show you a video so that you can gather more information with that. Medical emergencies, especially the communication during the medical emergencies, will find difference between life and death. Not only that, sometimes if you're not communicating properly, it may lead to life to death. So that is important.
Where a 65-year-old woman has been brought
Just
in
go
complaining
through
of
this video.
epigastric and back discomfort.
Hello, I'm Dr. Jackson. What's bothering you today?
Oh, doctor, I don't feel good. I feel really bad. I'm dizzy and I'm sick at my stomach. My son was really worried about me and he brought me in.
Okay, are you having chest pain right now?
No, but I'm hurting. It started in my stomach and now it's in my back.
Okay, we're gonna see if we can find out what's going on, okay? Joette, do we have a set of vitals from Ms. Fernandez?
Yeah, blood pressure is 70/40, heart rate is 45 beats per minute, respiratory rate is 16 breaths per minute, and pulse ox is 92%.
Okay, let's go ahead and start her on 2 liters of O2. Ms. Fernandez, we've got you hooked up to a monitor so we can take a look at your heart rhythm, okay? And we've started you on oxygen so you can breathe a little easier.
Your pulse ox reading is 95% with 2 liters of O2.
Oh,
Okay.
oh, doctor. Oh, doctor. I feel really dizzy.
Okay, it looks like we have sinus bradycardia. Dana, let's go ahead and get an IV started right now.
Miss Fernandez, Mrs. Fernandez, can you hear me? Mrs. Fernandez. She's unresponsive. I don't feel a pulse.
Okay, let's call a code. The patient's gone into VFib. Start chest compressions.
Starting compressions.
Mandel, you'll be on defibrillator. Shelley, you'll be recording.
Recording.
Sam, you'll manage the airway. Dana, have you been able to establish an IV access yet?
I've tried several times, but it's failed.
Okay, let's move on to IO access, please.
Moving to IO access.
24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Charging at 200 joules. Shock ready, clear the patient. Shocking on 3. 1, 2, 3. Shocking. Shock delivered.
I have IO access now.
Great. We'll continue CPR for 2 minutes and evaluate the need for additional defibrillation. Shelley, I'll rely on you to monitor the quality of the chest compressions. Dana, you'll need to draw the drugs up before each rhythm check, so if the arrest persists, we can move quickly to drug therapy. Let's begin with 1 milligram of epinephrine.
Try 1 milligram epinephrine.
2 minutes.
Okay, let's analyze. Switch roles. Okay, the patient remains in VFib. The protocol for this biphasic device is escalated dosing. Let's shock again at 300 joules.
Shocking at 300 joules. Charging. Clear the patient. Shocking on 3. 1, 2, 3. Shocking. Shock delivered.
Continue CPR.
Continue compressions. 1, 2, 3.
Dana, please give 1 milligram of epinephrine.
1 milligram epinephrine. And the IO is flushed.
Great. We've given 2 shocks and...
So that if you watch that video carefully, it illustrates most of the important basic principles about communication during medical emergencies. So we have to communicate basically with, if you are in the community, from the community with the healthcare facilities. When you are sending a patient, sending a child, so we have to communicate with the next hospital. Sometimes we have to communicate with the ICUs. Then inside the healthcare facility also, we have to communicate with each another. So if you go to that video again, you have seen that the doctor and the nurses are first communicating with the patient, then communicating with each other. So it's very important, especially during an emergency. So we have to call ambulances. So we have to call the emergency medical services. So they have to call the hospital. And especially during the emergencies, we have to discuss various things among ourselves. So during that code, there were 16 members of that code. So when we're having this type of big gathering, we know how chaos the situation is. So it's very important to communicate with each other. So if you go to the communication, it may be like this. A lot of people, so they will talk each other without any, anyone is listening. So everybody is talking, we don't know what is happening. It may be something like this. So somebody is telling something, but other one is not understanding. It may be like this. So only one-way communication. So what we want, especially in an emergency, is an effective communication. For that, there are two main aspects. So one thing is, we should know what to communicate. If you don't know what, it's very difficult to communicate. Sometimes I'm getting calls in the middle of the night saying that we are getting a patient, so 4-year-old child with asthma. So if I ask the calling person what is the respiratory rate, whether there's any the added sound, so he says, okay, I forgot to examine, so I'm going back. So that should not happen. We should know what to communicate. For that, this is very important for you all, especially you are starting your career. We are going through this SBAR. What do you mean by SBAR? So first thing is, when you want to communicate, we have to tell about the situation, who, where, and why. Then about the background, summary of the patient history, then assessment, your assessment, the clinical assessment, and at the end, your recommendation. I think this child needs this. So that type of thing. So we call it SBAR. So this is the gold standard of the communication, especially during emergency. And then, how can we communicate? So to communicate, at least two people should be there. There's a sender, there's a receiver. So sender will send some message to the receiver. Receiver hears it, receiver understands it, and not only that, he has to explain the sender, or the sender has to get explanation from the receiver, the confirm from the receiver that he has understood the thing. So we call this is a closed loop communication. So if you see that video, so somebody is telling, okay, I need 1 ml of epinephrine. So the receiver will say 1 ml of epinephrine. So receiver has understood it. So after giving that, 1 ml of epinephrine given. So that's the closed loop communication that we are talking about. Not only telling. So we have to know that the thing that we should have done. So that's important. So it's called closed loop communication. So this is it. So sender initiate the message. So then receiver accepts it. Receiver understands the message and giving a feedback to the sender, and the sender verifies the message at the end. So with that we are closing the loop. So that is important. Now we'll see the same video again with these things. So you will
Sharing,
understand more.
constructive
about this.
intervention, summarizing and reevaluation, and mutual respect.
The patient's gone into VFib. Start chest compressions.
Starting compressions. One.
Mandel, you'll be on defibrillator. Shelley, you'll be recording.
Recording.
Sam, you'll manage the airway.
Clear
Dana, have you been able to
responsibilities.
establish an IV access yet?
I've tried several times, but it's failed.
Okay, let's move on to IO access, please.
Moving to IO access.
24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Charging at 200 joules. Shock ready, clear the patient. Shocking on 3. 1, 2, 3, shocking. Shock delivered.
I have IO access now.
Great. We'll continue CPR for 2 minutes and evaluate the need for additional defibrillation. Shelley, I'll rely on you to monitor the quality of the chest compressions. Dana, you'll need to draw the drugs up before each rhythm check, so if the arrest persists, we can move quickly to drug therapy. Let's begin with 1 milligram of epinephrine.
Drawing 1 milligram epinephrine.
2 minutes.
Okay, let's analyze. Switch roles. Okay, the patient remains in VFib. The protocol for this biphasic device is escalated dosing. Let's shock again at 300 joules.
Shocking at 300 joules. Charging. Clear the patient. Shocking on 3. 1, 2, 3. Shocking. Shock delivered.
Continue CPR.
Continue the compressions. 1, 2, 3.
Dana, please give 1 milligram of epinephrine.
1 milligram epinephrine. And the IO is flushed.
Great. We've given 2 shocks and given 1 milligram of epinephrine. The next medication to consider is amiodarone. Dana, please prepare 300 milligrams of amiodarone.
Drawing 300 milligrams of amiodarone.
So let's summarize. So when you are communicating, your message should be very, very clear. It's mentioned here. And the loop should be closed. That gives the clear idea what's happening. And mutual respect and confidentiality is also important. Thank you very much.